So thank you for making time to be with me today. I am so excited to have you with me and to be aware that the chat box is totally functional. And so if you've got questions or comments that you want to drop into the chat box as we're going, that would be great. You will get so much more out of the time that we're going to spend together today if you interact with me. So I'm going to ask questions and ask for inputs, and feel free to type your answers in there, and let's just make sure that you are spending your time really well. I want you to know that I am not actually selling anything in this class. So if you thought this was going to be a high pressure meeting to try to get you to enroll in a class because there's a deadline, got to get it done right now. No, it's not like that. So if you thought you were going to be pressured, you can just sit back and relax, get your pen and paper out to take notes, or however you prefer to take notes. And we are going to take a look at the science and practice of iridology in a professional practice. All right, so this is a really important thing to do because a lot of people who maybe aren't familiar with iridology don't have an understanding of how it can be applied beneficially in a practice. So we're going to talk about that. First, a disclaimer: Cobblestone Health Limited, doing business as Iridology Education, and Judith Cobb, not responsible for any results, good or bad, you get from using the information I'm going to share with you today. You alone are responsible for the results you get. If you use iridology, you are responsible to have the appropriate liability insurance. Right? So if you're a practitioner, you've got to know the laws where you live. You are required to respect and adhere to local laws regarding required credentials for the use of iridology and the offering of nutritional or supplement advice. So just need to get that out there. For those of you who might be new to me, my name is Judith Cobb. I am one of only 8 level 3 IPA certified iridologists and iridology instructors in the world. This is a level that they just added a couple of years ago, and I was one of the first 3 to actually get the certification in place. IPA has standards, and that's one of the reasons I am affiliated with them. As an iridologist and as an iridology instructor with IPA, I have to renew my credentials every 2 years. I have to have proof of continuing education and adhere to their standards for professional conduct. And so when you see on these badges that we've got January 2024 to 2026, I've just renewed my credentials, and that's why it has these years on it. I've actually been in the holistic wellness industry since 1981, and I've been coaching people since then. And just a few years after that, I started teaching courses in herbs and nutrition, iridology as we knew it back then, and a few other holistic things, because where I lived at the time, I still live in the same city, Calgary, Canada, there were no courses. We didn't have the internet. It was really hard to find information, and I found that as I learned, people were hungry for it. So I started creating courses and started teaching it. I started this journey at the age of about 20. I had some health problems, and the medical doctors couldn't seem to put their finger on what was going on. I was still in university at the time, and I was studying to be a school teacher. That was something that I dreamed of since I was a very young child. But I ended up dropping out of university just prior to graduating to get married. And I also realized at that time I wasn't going to be happy teaching children. I love teaching adults. That is really what makes my heart sing. And so that's part of why I've ended up here, is because I love holistic health and I love teaching adults. Could there be a better career for me, well, aside from my clinical work, than actually teaching courses for adults? I've written and self-published many books. Most of them are out of print right now. I've designed and taught all kinds of courses, including the Dynamic Iridology Assessment System for Health Professionals course, which is an IPA-approved iridology course that includes what they consider to be the level 1 and level 2 curriculum. I've also designed and taught other courses: herbology, biokinesiology, color therapy. I was even a certified prenatal educator for a few years with the International Childbirth Education Association. That was a lot of fun. I really loved doing fertility and pregnancy work as well. And so Paige says, I'm amazing. Thank you, Paige. I just like to have fun and I like to keep learning and I like to always be teaching something. Those are the things that in as far as my career goes, make my heart sing. So again, if you have questions or comments, please drop them in that chat box. I'm also a master herbalist and I'm a professional member of the Alberta Herbalist Association. I'm a professional nutrition coach affiliated with the Canadian Association of Holistic Nutrition Professionals and CANP, as we like to call it. These, again, are organizations that require proof of training. They require CEUs to be done every year or every 2 years. And that, to me, is really, really important. The updating of information is critical. There's so much research going on. Things that I learned 10 years ago have now been updated, and we need to keep moving forward. Do you agree with me that it's important to keep up with research and to keep moving forward? If you do, let me know that in the chat box. Let me know that you think ongoing education is important for practitioners and for teachers. So my very first iridology teacher was a lay-trained herbalist, and she was also a first-generation Jensenian iridologist. And so this is an important thing because iridology's come a long way since then, a very long way. So let's talk a little bit about what iridology is. You already know this probably, and that's probably why you're here. It is the science of studying the iris of the eye, considering the base color of the eye and colors that are overlaid. It's also the science of studying the way the fibers are sitting in the eye. So we're looking for, what are these other pigments? What are they telling us? What are these fibers doing? Are they straight? Are they wavy? When we've got a really dark brown eye, what's that all about? All of this helps us to understand the genetic predisposition of the client as far as their health is concerned. And when we layer this information, what we see in the eyes, with information the client gives us, then it gives us a deeper insight into what our clients need, right? So the client comes in and they have symptoms that they want to have corrected. We look in the eyes, we see what they tell us, we combine the symptoms with what the eyes tell us. It gives us information with which to ask questions, and that helps us to get deeper and deeper and deeper information until we understand the order that things need to be worked on, right? So we're not going to work on everything all at once, because we need to trace things back to the root. What is the root of this problem? And as we deal with that, other things will come into, will fall into place. Does that make sense? If that makes sense, give me a makes sense in the comments box. All right, and again, the more you play with me in that chat box, the more you're going to get out of me, right? We need to remember that iridology is not diagnostic. So I can't look at either of these eyes and say, you have this problem. As iridologists, we are not allowed to name diseases. Even if you are a licensed medical doctor, you would not use iridology to diagnose a disease, but you would certainly use it to help guide your further medical investigations. That's how it's used in many European countries. Now, what about sclerology? What about sclerology? Sclerology is a very dynamic thing where the irides are genetically determined, and they will only change in a certain direction based on genetic cues. The sclerae are very dynamic. When we see blood vessels that are enlarged, and these are all images from one person's eye, we want the sides and the top and the bottom of each eye. When there is something going on dynamically in the body, blood vessels become enlarged or they become obvious in some way. And this gives us clues as to which parts of the body are under stress, and can sometimes gives us clues as to in what way that part of the body is under stress. Right now, The interesting thing here is oftentimes we actually see markings in the sclera, particularly the blood vessels, as indicators of something is changing now, but it hasn't changed enough to become a symptom yet. And so this can often help us to understand better why our client has symptoms, right? So this is a really important warning sign. Certainly, if they've got symptoms and they've had symptoms for a while, or it's been brewing for a while, we might see a more pronounced blood vessel or a more pronounced marking in the sclera that is going to confirm the symptom. And it's also going to then, when we combine that with the iris, help us to understand more about what's going on. If we see the genetic predisposition in the iris rather, and we see the blood vessel activity in the sclera, and we've got symptoms, we now have an even deeper understanding of why things are happening. So why do we need both of these? Well, we need both of these because typically holistic practitioners like you and like me have either experienced or heard about iridology as a diagnostic tool, and we're looking for ways to assess our clients that are non-invasive, right? That might be why we need both of these. Maybe it's because we've already studied iridology and the way we learned it, it's not working for us. And so we wonder if we're missing something or we're doing it wrong. So if it's not working for you, that's why you might need iridology and sclerology together. Maybe as a holistic practitioner, you're just curious. You've heard about it. You wanted a way today to investigate it a little bit further, a way that didn't involve a lot of money, not much commitment, to show up for an hour. That's great. That's great. Maybe there's another reason why you've showed up today and why you're wondering, why do we need both iridology and sclerology? And if you've got a reason different from what I've talked about here, drop it in the chat box, because and if you want to send it to me privately and not have me read it out loud, I totally get it. I will honor that for you. Really, what I want to know is, why are you here today? Why do you want to know more about this? Because that's going to help me to tailor make this presentation on the fly to help you get what you came for. Okay, so go ahead and just lightning finger that into the chat box so that I can do this for you. So again, maybe you've heard about, and we're going to dive into these a bit deeper, heard about or experienced iridology as a diagnostic tool. Now, and a low invasive way to actually assess your clients. It's not a diagnostic tool. We've mentioned that earlier. It is an assessment tool. When I teach iridology, and the way I teach iridology, it will, when you master this skill, it will save you hours on client assessment. You'll be able to assess your clients using their eyes and their symptoms in under 20 minutes. And I actually practice that with my students and get them to do assessments in class in under 10 minutes and hit the points they need to hit. So important, because so many iridologists see the client, gather information, then they go off and they spend 2 or 3 or 4 hours. Or I had someone who said she spent 3 days creating an iridology assessment, and then she would bring that back to her client later on. And with that, it means that you're not getting paid for the time you're not with your client, right? They're not going to pay you for that extra time to write a report. So other reasons that we want this is, when we do iridology, the way I teach it, where we can do the assessment and create the program literally in about 20 minutes, it allows the rest of that time in your 1-hour time slots for you to develop rapport develop rapport with your client. You know, it's so important, because a bonus to this is the deeper the rapport you create with your client, and the better you are at creating compact programs, the more they want to come back and work with you. This is so important. And what I find happens is my clients will come in as new clients and we'll work with them once a month for 4 or 5 months, get them to a really good place, and then they disappear for a while. And I know they're going to do that, right? But I also know that a few years later, they are going to come back to me when they need it. Right? And that's brilliant. I just had an email this morning from a client I saw 5 years ago. We solved her issues then. And she was saying, I have this problem now. Can I come back? Let me think. Will I let you come back? Heavens, yes, yes, let's get you in, right? And so this is so, so important. So I just want to share some of the comments that have been dropped in the chat box here. Paige Ward is currently enrolled in the program. I'm here today because I truly love everything I've learned thus far in iridology and want to continue to stay in the energy of learning more and listening more with you. Oh, thank you, Paige. Thank you. Malia, I hope I said your name right. I'm interested in the importance of iridology and adding it into my health coaching practice. Beautiful, good reason to be here. Kara says, registered nurse here. Yay, welcome. So good to see more medical people becoming more holistic in what they do. Brilliant. I'm looking eventually to move from bedside to a more holistic practice. I see so many patients on so many medications, and I'd love to help people find the root cause of their health issues. I'm just getting started on my journey and love all of the information that you're sharing. So good to hear that, Kara. Welcome, welcome, welcome. All right. So when you've got clients who keep coming back, that serves you in a couple of ways. Number one, it reduces the amount of money you have to spend on advertising. Right? It costs more to find a client than to keep a client. Number two, if they're coming back, they're also chatting you up to their friends and family. I had another client book a new client book an appointment, and on the little booking referral form where they're telling me just a bit about what they want help with, it asks, how did you hear about me? And she gave me the name and she said, so-and-so, a client who I'm currently working with loves you. So I knew I had to come in. Right. And so that's what we want to do. Right. We want to create that community of like-minded people. And that's what we want for our clients, people who want to be coached to wellness, not people who want the magic drug that, that take this and take this and take this, or the little ping on the head that's going to make them better. We want people who are engaged in their health. Maybe you studied iridology already and it's not working for you. Now, this is something I take very seriously. If you studied iridology and it's not working for you, it's not your fault. And this is going to sound harsh. I apologize if this offends anybody. It's your teacher's fault. And I say that because I've had a lot of students who were previously certified by other instructors, but who weren't taught how to use iridology in clinical practice, and they feel like they failed. They've studied the nuts and bolts, but they weren't taught how to use it in practical application. Because teaching application takes time, and most teachers are not willing to invest that time. I'm going to give you some practical examples of this in a few minutes as we work through some case studies and as we actually look at, as I was teaching you some basic iridology today, right? Maybe, again, you're just curious and you want a low commitment way to investigate it further. This is totally fair. When I went to university as a young adult, I applied to 2 schools that I thought I wanted to attend. Neither of them were near my home. And I was accepted at both of them, which really made me happy because now I had a choice. But the one that won out was the one that invited me down for a weekend to show me around, right? To introduce me to other students who were also looking at the school, to introduce me to other students who were in programs I was interested in pursuing. And so that I think is really important. I think you should be speaking with prospective teachers you want to study with. I think you should be interviewing them to find out if they are right for the job that you want to have done here. And that's basically a part of what we're doing today, is giving you a sneak peek at the kinds of things you would be learning and at my teaching style to see if this is going to fit for you, right? So I'm really glad you're here. Now, again, this is a really interactive open house. I've got stuff I want to share with you. I'm hoping you're going to take some notes. I'm hoping you're going to ask questions and interact with me. It's not a one-way street here, folks. I never teach just to yak at you. I teach for interaction with you. So the facts of the matter are that iridology is a powerful assessment tool, and confidence can be developed, but it usually requires some mentoring. Most of you have been with me in weekly mini classes in previous times, so we're going to keep moving on now. Just one thing that one of my previous students has said, one of my graduates, this is Karen, lovely Karen. She came to me already certified as a CNHP. And she posted this in a Facebook group that we had back then. I just returned from a regenerative detox course where iridology is implemented. I spread the word about what a wonderful teacher you are. Most people I taught with did not have anywhere near the same experience with their iridology education. They had no support, unanswered questions, and a lot of confusion. Mostly they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed to have been taught by you. I feel totally supported, even still, as I've graduated almost like 5 or 6 years ago now. I don't think there's anyone out there practicing, educating, and teaching iridology like you. Thank you from the bottom of my heart. I'm eternally grateful for your never-ending patience and support. So later I asked her, how has learning constitutional iridology, which is what I teach, helped you in your business? And she said, it has helped me to understand the relationships between the different organs and organ systems more in depth, right? She already had the basics from her CNHP, but more in depth. I love that. Iridology also gives me an advantage of seeing the potential for different genetic traits and qualities that may be underlying. By observing the constitution, for example, you can extrapolate how the person's body will likely respond to applications of healing methods. Therefore, it's helped me to expand my knowledge and increased efficiency at providing more precise recommendations for health-oriented options. So I'm going to invite you to stay to the end of our time together today, because I will offer you an invitation to actually speak with me privately about the course to see if it's a fit for you. But we have some other things we want to talk about. Now, also, I'm recording this, and with any luck, I'll get the replay out for you tomorrow by email. So if there's anything you wanted to review on the iridology portion of it, you'll have that. But I'm also going to suggest that, if you've got friends and colleagues who might be interested in studying iridology, share that replay link with them. Give them the exposure that you're getting today, and let's see what they want to do with it. All right. Iridology is an amazing skill set, and we're going to look at case studies, but first we need to look at the eyeball just a little bit. We got to know what we're looking at, right? So when we are doing iridology, we are looking at the iris of the eye, which is actually primarily a muscular structure in the eye. This is genetically set. The way the fibers are sitting in the eye is genetically determined. The colors we see in it are genetically determined. And we will also touch on, I don't know if we're actually touching on sclera. I don't remember if I included that in here today, but in training, I will teach you sclera as well. So to look at the white of the eye for the blood vessels, so that we have extra points of triangulation. We also look a little bit at the cornea, because the cornea can give us specific markings that can build with time. And we look at the pupil. Who would think that the opening that we call a pupil could give us information, but even that gives us information. So when we put all of that together, we get that insight to understand how this person is put together, where there might be some things that might need some attention. Have they been long-standing? Are they quite new? And that will guide what we want to do next. So we know we've got 3 basic eye colors. We've got the basic blue eye. We've got what some people call a mixed eye. In constitutional, we call this the biliary eye. And we have the true brown iris. Now we're going to look at each of these separately quickly a little bit here. I think I've got a case study from each one of them for you. And we're going to kind of dissect them and talk about them. So shoot out your questions in the chat box as we go. So when I first started learning iridology in 1979, constitutional iridology was not yet a thing here in Canada. It was actually in its infancy in the US. It was brought to the US by someone who had learned it through reading books that were written in German, because that's where constitutional iridology started. But I had the Bernard Jensen Foundation, and 5 or 10 years into my working in that style, I was really frustrated because I'd been taught things that just weren't bearing out. I was taught that we could take a person that had lots of pigment in their eyes and we could fast them and cleanse them and give them all these herbal things and vitamin things, and we would take all that extra color out of their eyes and they would have blue eyes. For all the paces I put my clients through, it never happened. I would see things like this in an eye, and I'd been taught that each of these was a pathological problem happening right now. But yet when I would say to my clients, well, your eyes say you have this, you have this, you have this, I mean, we were diagnosing dangerous territory. 90% of the time, my clients said, no, no, no. So that was frustrating. We were taught so many things that just didn't bear out in practice. And that was when I was about ready to quit. But that's when I was ready to learn something different. And that's when constitutional iridology came across my path, which was so exciting. So when we see a blue-eyed person like this, first off, we know that where this person is likely to have more challenges is going to be with their mucous membranes and with their systemic acid levels. So I'm not talking digestive tract here. I'm talking the pH of their blood, especially their blood, right? And their lymphatic system. So we're thinking mucus, systemic acid, and lymphatic system. So I want to know from you, what kinds of symptoms might you see with the increased tendencies of mucous membranes not doing their job, or blood acids being a little bit too acidic, or of lymphatic congestion? I want to know, what kinds of symptoms do you think you would see? And then I'm going to tell you the kinds of things that we typically do see. Give you just a minute to get that typed in. Get to digging back into any training you've already got. Your anatomy and physiology, what did you learn there? And you can give me one-word answers. We don't need to have books written here. Okay, how are you doing? You getting some down? Someone has mucous membrane challenges with too much acid in the bloodstream, or challenges with their lymphatic system. What are we going to see there? I think the internet might be a little bit slow right now, so I'm going to move ahead so we don't spend too much time. What I see is, Paige says she missed the question. So the question is, what kinds of symptoms will we often see if someone has mucous membranes that are not behaving, elevated blood acid, or lymphatic congestion? So the things that we often see are things like asthma, allergies, arthritis, skin, and kidney concerns. Kara, those are really good ideas. Sluggish liver and gallbladder, those are going to apply specifically to another eye type we're going to look at. They're not so much the blue eye, not so much. But I love that you put that in. Fantastic, because we're going to hit those in just a minute. So this is, when we see a blue-eyed person, it doesn't mean they will have those problems. It means there's an increased risk, an increased predisposition towards those problems. So maybe this person has already figured out that if they consume dairy products, if they consume white flour, if they consume white sugar, they get really congested, or their lymph glands get all swollen and their immune system starts to tank, or their arthritis starts to flare up, or they have asthma attacks. So maybe they figured that out a long time ago. So they're really being careful with their diet. So they don't have those problems. So the eye still says the predisposition is there because that's the genetic tendency. But this person has already begun to understand what their body needs to be well. And this is exciting. Now we can add more layers of information to this by evaluating where are these markings sitting, by evaluating different colors in the eye, by looking at how different fibers are sitting. These each give us different information. All of these things are not important in every appointment with that client because these may teach us things about other symptoms that the client is not concerned with just yet. And we never want to overwhelm the client with so much information that they go, well, what do I do with all this? We want to keep things laser focused so they can do their homework and get excellent results. In constitutional iridology, we know that these that we call lacunae, a Jensenian would call these lesions, these are inherited. These are inherited over the past 3 to 4 generations. They get passed down and passed down and passed down. They resolve. So if I have taken really good care of myself before I have children, I may be able to pass on to my children a stronger genetic structure than what I had. I might be able to pass on better genes, better genetics than what I had. But these do show areas that there may be some challenges. And so we don't necessarily want to burden our client with what every one of these relates to. But if this client comes in with a symptom that is related to one of these, now we have a deeper understanding of it. When we have as many as we do in an eye like this, this is an indication that they're more prone to endocrine imbalances. And we can laser in on that as we need to. So that leads to questions, right? Like, does this client have symptoms of any kind of hormonal issues? What is this client doing for their health? What is their blood sugar like? Because that's an endocrine function, right? If this person's on track, if they're doing a lot of things right, then our job is to encourage them to continue on with that and to build on that. If she's not on track, she may need coaching, right? She may need a lot of coaching to balance her blood sugar or get her hormones balanced or to support her digestion. One of the things we can suggest for people with these kinds of eyes, that's not a supplement, it's not even a food, is creativity. What do they do for creativity? Because these people almost always have a creative streak. And by honoring that emotional side of who they are, it helps to bring the physical closer to balance. It makes it easier for us to work with them on that physical metabolic level. Now, as she implements specific changes that her symptoms and her eyes have asked for, she will begin to see improvement in her health. We're not going to see these eyes change, but she will feel the difference with her energy, with her blood sugar level, with whatever else is going on. Okay, Kara, this is the eye that you were talking about and you didn't even know it. So congratulations on being ahead of the game here. In my early iridology training, I was taught that an eye like this needed cleansing, that all of this brown and yellow and orange meant, oh my goodness, you are so toxic. And you've probably taken sulfa drugs and your kidneys don't work. And oh my goodness, you are a train wreck, right? And we were taught that when we cleanse this person, their eyes would turn blue. We now know that is not correct. We know now that there were teachers who were teaching this and they would have pictures, color pictures in their textbooks, in the books that they were selling, that showed before and after photos. And they looked convincing. But back then, I didn't know anything about the technology of photography. We didn't have Photoshop back then. And teachers weren't teaching about the technology and how photos could be altered. And what we understand now is that those teachers were doing one of two things. They were either using color filters on their lens, so they would do the before photo, then they would put a color photo on their a color filter on their photo and take another photo. One author, who shall remain nameless, admitted to doing that because she was up against print deadlines with her book. That's very sad. We know that in other cases, people who were publishing books took photos that looked very similar, but one had more pigmentation, the other had less pigmentation. They were different people, and they were posting these as before and afters, which of course they weren't, because they were different people. What we now know is that technology changes everything. You can, by changing the camera brand, by changing the lighting in the camera, the source and the quality of it. Is it LED? Is it incandescent? How bright is the light? It all changes the output of the photo. And so even the device that you're looking at this on, I've got two computer screens connected to my computer, and I can have the same photo up on both, and the colors are dramatically different. So we have to understand that even our tech devices can make things look different. When we used to do prints of photos, the brand of film, the brand of camera, the brand of film, the brand of paper, all changed the output. And then of course, whatever color of light you were using for your photography, back then it was mostly incandescent, right? So that all just made it so frustrating. And again, I was ready to walk away from it because it wasn't working. When we look at a biliary eye like this, here is what we know. Now, some teachers will call this a mixed eye. In constitutional, we call it a biliary eye. I want to come back to this for a second. When we're talking about biliary, this is a person who often has a brown-eyed person somewhere in their recent bloodline and a blue-eyed person somewhere in their recent bloodline. So it's usually the mixing of the blue and the brown, which is where they get the term mixed. What we know instead is that these colors give us an indication. They point us in a certain direction. So this is where we're going to come back to Kara. This kind of coloration often suggests an increased predisposition towards liver and pancreas types of issues. So we're thinking, you know, what does the liver do? Well, what doesn't the liver do? It does 650 jobs, from neutralizing things in our blood that we don't want to have there. That's your phase 1 and phase 2 detox, to storing iron, to creating immune factors for us, to you name it, it does it. So this can give us indications about any of those liver functions. The yellows in here tell us that the kidneys have an attitude problem, that they may not want to do their jobs quite as well as we would like. The positioning of the colors tells us much as well. This is telling us that the liver wants to put stress on the stomach and the intestinal tract and on the nervous system, which of course it can do, right? So what kinds of specific symptoms might you see if the kidneys weren't working well, or if the liver wasn't working well? You can dig back into any training you've got. What symptoms make you think, oh, I wonder how their liver's doing? Or, that sounds to me like we need to pay attention to kidneys. What kinds of symptoms? You see, this is how I teach my iridology course. I don't just give you information. I want you digging back into what you already know. I want you working with integrating this with the knowledge you come to me with. Teaching you iridology as a standalone is not helpful anywhere. So what kinds of symptoms would you expect to see from the liver? It does 650 different jobs, people. You can name just about anything and get it right. What kinds of symptoms might you see if the kidneys are not behaving? Anything in there? Oh, you're a quiet group. You're a quiet group today. I will give you a little help here. Liver, some things that I classically see could be things like, oh, Kara, hypertension. Yes, yes. If the kidneys aren't working, yes. Congratulations, because that's one that a lot of people don't attribute to kidneys. Well done. Yeah, absolutely. So, and that's one that I was going to mention. So love this. So kidneys, it could be fluid retention, like obviously getting puffy, right? It could be hypertension. It could be dehydration if the kidneys are in overcharge here. If we're looking at liver, it could be allergies. It could be sluggishness with digesting fats. It could be greasy bowel movements. It could be a reduced immune system. It could be problems storing iron, right? It could be so many things. And so when we understand this, then we understand the kinds of questions we need to ask, and we can start correlating our client's symptoms to what we see in the eyes to ask questions to determine the best way to handle this. Now, we can identify markings, but it's never a case of one marking in the eye equals one problem. And that's why you need to have a solid foundation on with your anatomy and physiology, right? And how the organs work together or how they work against each other. And we need context. This is why we need to understand, what are the client's symptoms? What is the client doing for themselves right now? Or are they starting from ground zero? Are we their very first experience, and we are going to need to be educating them at the very most foundational levels, right? Like, there's no such thing as a junk food that is safe. All junk food is anti-nutrition, right? So when we understand that, and then we correlate it all with the sclera, again, it gives us that deeper understanding as to how to best strengthen the body and how to help our client take control of their health to regain as much of their health as possible. This eye also suggests that this person has a tendency towards being sympathetic dominant. When you think of the nervous system with sympathetic and parasympathetic, what kinds of symptoms might you expect to see in someone who is sympathetic dominant? What might you see in someone who is sympathetic dominant? And while you're typing that in, what would be a simple recommendation you could make to a client who was sympathetic dominant to help them have more control of that? What do you think? You may have heard of, Paige, I like this. She's got some good recommendations there. So we'll talk about those in just a second. When we think of someone who is sympathetic dominant, this is someone who spends a lot of their time in fight, flight, freeze, or fawn, right? Elevated heart rate, Carrie, yes, absolutely. Elevated heart rate, one of the key indicators that heart rate starts to beat up because the body is preparing for a fight or to run, right? And so this person defaults to sympathetic a lot. That's going to deplete certain nutrients in their body. That's going to create more challenges for different organs in their body. So we already know then some things that we need to pay attention to, right? And as we ask about their symptoms and what they're already doing, maybe they're aware of this already and they've already got things in place, but maybe they're not. And they're struggling with anxiety or depression or anger or things like that. And so I love this page has given some good suggestions. EFT, tapping, flower essences, yoga, meditation, earthing. They may suffer with anxiety and shallow breathing. Absolutely. So as we see these eyes and we understand this, it gives us that information for us to be able to work better, more effectively with our client, right? Not one marking equals one problem, but we need several markings to give us information here, right? So this is so good. For example, when we've got someone who does default to sympathetic, we know they burn through their B vitamins very quickly. B vitamins are critical for liver function, right? This person, we've already said, being biliary, the liver tends to want to be a little stressed. It tends to not want to do its job all the way. Maybe it needs B vitamins, but if this person is spending too much time in the sympathetic zone, they're burning through their Bs before the liver gets any. So now we know we need to maybe increase their B vitamins while we are helping them to learn some coping strategies, EFT, or sending them for yoga classes, or getting them to stop and take some really deep breaths to bring things back to normal. It's not always about a pill to take or a herb to swallow, right? brown eyes, the true hematogenic eye. So the challenges that our hematogenic people tend to face tend to be more along with blood chemistry. Again, a little bit of liver can be in there. These people tend to run a little more alkaline. Now, that can create some problems in and of itself because we need certain acid levels to actually be able to absorb and assimilate and utilize our minerals. So these people, if they don't have enough acid, may not be able to get their minerals where they belong. And so if you don't have enough minerals, that endocrine system is going to struggle a little bit. So with that, we may need to be working with the liver and the B vitamins and things like that to try to get them into balance and some digestive support to help them have the acid levels they need to get their minerals. Is that all making sense? Are you following the pathway that I'm describing? If you are, give me the word follow in the comments box so I know you heard and understood. Give me the word follow. Kara's saying follow. Well done, Kara. Anybody else following this? If you feel like you're getting lost, just let me know. And I'll go over it. I'll find a different angle to come at it from so that it sits with you. Otherwise, you're wasting your time. And I don't like to waste time. So old iridology would have said that this person was headed for a nervous breakdown and needed to cleanse parasites. Now, the nervous breakdown, I would never go that far, but it does say this person's nervous system, again, they run in that sympathetic mode, probably going to need some support there. Parasites are not a genetic thing. If I have parasites and I get pregnant, I don't give those parasites to my baby through genetics, right? This has nothing to do with parasites at all. It has other meanings with constitutional iridology. We always look at the eye in the context of what our client has asked for help with. So let's do a bit of a case study with this one. This is the eye of an Asian woman. She and her husband came to me. They were in their mid-30s. Her concern was infertility. The fertility clinic had been unable to help her. They'd been going there. They've been trying for 3 years. The fertility clinic just, they gave her the Clomid, they gave her the metformin and said, that's all there is to do. One thing I noted was, of course, these rings, we call them contraction furrows, going around her eye. And when I added to that she has a few other indicators, I suspected she might have problems methylating her B complex, her B vitamins. And as you probably know, that would suggest that she has the MTHFR defect. Now, I can't test for that, but I suspected this. I didn't tell her that's what I suspected because that would be a diagnosis, right? We don't diagnose. So the first thing I did was I got her off the cheap drugstore brand of prenatal vitamins, and we got her onto a really good methylated B vitamin, because if she doesn't methylate her Bs, she won't have her folic acid and she won't have her B12. And that is going to be an issue because that will reduce her fertility. I also suspected from this little white haze hanging at the edge of her eye, we call that a lipemic diathesis, that she might have some liver enzymes issues that might affect her ability to metabolize carbohydrates. So as we were in that initial conversation, I asked her, I'm seeing enough things here and putting pieces together, probably MTHFR defect, probably not handling her carbs well. And I asked her, has anyone ever suggested, notice I'm not telling her she has this, has anyone ever suggested that you might have a problem with your blood sugars? And she said, oh yeah, the doctors have diagnosed me as type 2 diabetic. All right. And then of course, we're talking about fertility. So I asked her, tell me about your menstrual cycles. How often do you have one? Oh, about one every 3 months, about 90 days. Well, that alone is the first step in a medical diagnosis of polycystic ovarian syndrome. And if you know anything about PCOS, which I hope you do from your A&P, PCOS and type 2 diabetes are best buddies and they mess with each other constantly. Now, I would not have known to ask all those questions if I had not seen what I saw in her eyes. Because I saw what I saw, I was able to work with her and her husband. They were such a sweet, sweet couple. With their diet was, and I see this a lot with my Asian clients, they bring the white rice, they bring the worst of what the Asian diet has and combine it with the worst of what the North American diet has. And they wonder why amongst their populations, they have such incredible rates of type 2 diabetes. We got her diet straightened out. Her husband took over all the cooking because she started to panic. I can't do this. And her husband said, sweetie, I'm just going to cook. I'll do all the cooking. You just have to eat what I cook. And she relaxed. And he did. He did a brilliant job. It took us about 6 months. We got her cycles down to that 35-day range, which is great because a 90-day cycle will always be infertile. Even if she ovulates, she cannot hold a pregnancy on a 90-day cycle. We got her down to 35 days, and it took about another year of really focused work till she got pregnant, and they had a beautiful baby boy. So that was very, very cool. Very cool. But again, I wouldn't have known to pursue that line of questioning specifically with her without seeing her eyes. So how is iridology used? We use it to understand genetic tendencies. We use it to stimulate our client-specific conversation to help us understand our client's needs on a deeper level. So I don't have a long list of questions. I don't use a questionnaire. My clients do not fill out an intake questionnaire. I use the eyes, their concerns, and the eyes to guide the process. It helps us to understand how best to support the body with foods, supplements, essential oils, lifestyles, and emotionally. It helps us to understand what foods and lifestyle habits will likely be harmful to a person, as well as what kinds of supplements may be ineffective. It teaches us about the inherent strengths and challenges of organs, glands, and tissues. And it teaches us about things that have tendencies that have been passed down through the last 3 to 4 generations. This is a truckload of information that we're gaining from just understanding our client's eyes. It can show us tendencies towards sympathetic or parasympathetic nervous system imbalances. It can show us circulatory, hormonal, and glandular, connective tissue, and lymphatic system insufficiencies. And when we understand that, we have a deeper understanding of how to work with it. It can tell us if our client has a predisposition towards elevated uric acid or elevated cholesterol. Now, notice I'm not diagnosing anything. I'm using the tendencies that I see in the eye and connecting the dots, understanding the markings and how one leads to another, leads to another. I'm understanding how the body works to begin to understand my client's health. And that then, when we combine it with lab tests, I cannot requisition lab tests, but my clients like to bring them into me, very helpful. I will sometimes send them back to their medical doctor to get labs done. When we can combine it with lab tests, it adds a deeper understanding. I see predispositions in the eyes. I see how the lab tests work. That helps me to understand even more deeply what I need to do. And more importantly, what I need to teach to my clients, right? This is an education process. I make them understand. That sounds like I'm being heavy-handed. I work with them to help them understand that I am a teacher and a mentor. They are their own healer. The better they do the homework, the more likely they are to get the results they were hoping for. What can we not do with this? I can't diagnose current or past pathologies. I cannot tell if someone has had surgery or broken bones. I cannot determine from looking at their eyes if their blood pressure or cholesterol is out of line or what the levels are. I cannot show if arteries are blocked or hardened, although the sclera may show a tendency regarding this. It's not a guarantee. And I can't assess from the eyes for hemorrhage, stroke, or heart attack. Again, there are some indicators that suggest a person may be heading in the direction of a hemorrhage or a stroke, but it's not a guarantee. We cannot use iridology to determine if a person has had an abortion, a miscarriage, or is sexually active. We can't use iridology to tell us if there is a tumor. We can't determine the presence of kidney stones or gallstones. Those are things that we need to send our client back to their primary care physician to get the appropriate testing done. We cannot diagnose the presence of yeast or parasites, although there are some sclera markings that give us a strong indication that there might be yeast or parasites. We cannot confirm a virus or bacterial infection status, as in an active infection now. But with sclerology, there may be an indicator that suggests that something is out of balance in that direction. We can't distinguish gender, age, predict lifespan, or impending time of death, nor can we determine if a person needs surgery. Those are all medical practices. With the language of iridology, we never name a disease. We are always assessing predispositions and inherent tendencies. So important. Iridology is a fast and insightful way in the hands of well-trained practitioners of assessing client needs. This is really important, and you can do a lot of good iridology with some basic handheld equipment. In the course, I have my students purchase a lighted magnifying glass. That's where we all began. And with the improvement of cameras on our smartphones, we can get usable photos most of the time with a good smartphone. Okay, so we can do that. So to start learning and to learn it well, you don't need to have an expensive setup, but eventually you would want to have a proper setup. When we do an assessment, we need to remember that we never assess someone's eyes without their permission, right? That is so important, because we may understand things about them that they don't want anybody to know. That's none of our business. So we need to respect privacy. Because when we do an assessment, we see our client on so many levels, physically first, but we see emotional tendencies there as well. It's critical for us to have that college level anatomy and physiology for understanding this fully. This is one of the reasons why I require it before I allow anyone to enroll in my program. But it's also a requirement with IPA, with the International Iridology Practitioners Association. Should you decide you want to become certified, they will require proof of that college level anatomy and physiology course with a grade of 80% or better. So a pass or fail will not count. You need to have a grade on that. We need to understand how the body works in order to do iridology well. Now, historically, iridology has been around for millennia. There's archaeological evidence of it from China, Greece, Egypt, and India. More recently, Italy, Germany, Europe, America, and Australia. Of course, it's still developing. Many of you have heard the story of Ignaz von Petschle, the little Hungarian boy who trapped an owl, broke its wing in process. That's one of the versions of the story. He said he saw a black line form in the owl's eye, and that as he nursed this owl back to health, that black line disappeared. Sadly, that's never been replicated. There's no veterinarian or vet techs that have ever noticed that. So we have to take that story with a grain of salt, except that whatever Ignaz saw or thought he saw spurred him on to become a medical doctor and to begin drawing out the eye photos of his patients and outlining their stories. And he began to create the first modern day iridology map. Then in the 1900s, up until just about the turn of the century, Bernard Jensen did a great job of taking the information that he had learned, which a lot of it was still theoretical, but it had been published as if it had been proven. He took a lot of that information and used it. He did a lot of good for a lot of people. Some of the information, enough of it, didn't hold up under scrutiny, though. And so that's when Harry Wolff and Bill Cardona come on the scene. On the American side, Harry was an American-born German who could read German. He got his hands on a book by Joseph Deck, and who was one of the early researchers in Europe, and it was constitutional. And so from there, he and Bill Cardona started teaching it. And that was the early foundation of what is now known as IPA, or the International Iridology Practitioners Association. This is the leading accrediting body for iridology in the world. IPA's mission is to increase and communicate knowledge concerning the art and science of iridology while promoting excellent international standards. Now, you will have seen many iridology maps out there. This is the one we use. It's based on the work of Bill Caradonna, and I updated it with his permission. It needed some updating. There was some more discoveries that needed to be added to this. Most iridology maps are very complicated. When we're doing constitutional iridology, we're not so concerned about the knee and the foot and the elbow and the earlobe. We're more concerned about the organs that have a metabolic impact. And so for most of your iridology analysis, a simple map like this will actually help you get further faster, which is why we use this. Again, you need your anatomy and physiology. And we're not, one of the big differences here is, again, that we use larger areas in the eye. We're not subdividing the brain into all of its little pieces because we don't have a herb that works on an individual little part of the brain. But we have herbs and nutrition that nourish the whole brain. And so when we're using these bigger areas, it helps us to actually be more precise in our work. Can you imagine if this was, if we had an area here, which on the Jensen map, this is subdivided into many sections, into like 5 or 6 sections, this area alone. If you're rotated just ever so slightly, your assessment's going to be wrong, right? And so we don't want to do that. And so with this, some basics. The right eye reflects the right side of the body. The left eye reflects the left side of the body. If you're pretty astute, you're going to notice that the head areas are at the top. Areas in the lower torso are at the bottom. Areas that sit on the midline are at the very center. Organs that are off the midline are off to the sides. Okay, so that's important to note. One key exception is the pancreas, which appears in 4 different places in each eye. Even things like the liver, you know from your anatomy that the liver is biggest on the right side of the body, but it extends across to about halfway across the left side of the body, which is exactly why we have this reaching over onto the left iris. Notice that we also have 7 concentric rings here. This iris map is like 2 maps in one. These rings give us very specific information about different functions in the body, the stomach, the intestinal tract, how nutrients are transported through the fluid mediums of blood and lymph, how the major organs and musculature uses nutrients, how the bones use it, the surface blood and lymph, how does it circulate, and the skin and the surface detoxification. And then we have the organs on top of here. Notice that just as your colon goes up the right side of your body, across the body, and down the left side, it goes up the right side of the eye, across the body, and down the left side. So it makes a perfect little body. All right, let's do some quick case studies here. All right. So we're going to do one from each of the different 3 constitutions: lymphatic, biliary, and hematogenic. So we're not going to point out every marking. Whoops, I did not mean to do that. But we are going to look at some things that are important here. So our primary constitution here is we are lymphatic. So we know that predisposes this person to being overacidic in areas like their mucous membranes. When we look at their fiber structure, we are looking and seeing that this fiber is fairly well organized. So we want to know, is the fiber tight? Do we have lots of threads per square inch? Are there spaces between fibers? Are there leaf petals or flower petals between fibers? We want to look at shading. Do we have areas that are darker than others? Okay, those are the first things that we look at when we are looking at an iris. So then we want to ask, what are the client's concerns? Why did they schedule this appointment? Then what do I see in this eye that gives me more info? What questions does that trigger? What do I see as strengths? And what is the client doing for their health? So this is a gentleman, 64 years old. He's been a client of mine for about 6 or 7 years, and there was a gap in there of about 5 years. 5 feet 11 inches tall, 175 pounds. He had just recently been to the doctor. Now, we did some really good work when we first met years ago, and he had fallen off the bandwagon. And so the doctor was now telling him his hemoglobin A1C is 7.2. His glomerular filtration rate is 61. The lowest acceptable is 60. Anything below 60, and we're into kidney failure. His potassium was slightly low, but that was probably due to the fact that he was taking a diuretic because he also had high blood pressure. The doctor had diagnosed him as being pre-diabetic because his blood sugars, his hemoglobin A1C, or sorry, his blood sugars were testing between 6.8 and 7.5. So the doctor had given him metformin, which led to diarrhea. So they switched him to Glumetza and Giardians. He still didn't like those very well. He was also on hydrochlorothiazide, which is a diuretic for his blood pressure. He was on Trandolapril for his cholesterol, sildenafil because the blood pressure medications that he was on were reducing his ability to perform sexually. So now he needs Viagra to counteract a side effect. He was on myelin torvastatin for cholesterol. Wow. All of those drugs added in the 5-year interval since we last worked together. I also noticed that he spent a lot of time going clearing his throat. So that always makes me wonder acid reflux, because you can have acid reflux without heartburn. And the acid reflux leads to excess mucus in the esophagus, which leads to throat clearing, right? Does that make sense? Is this all fitting so far? If it's working, give me working in the comments box. Let me know this is working for you. His diet, his breakfast was cinnamon buns or a muffin or Cheerios for breakfast. Anyone see a problem with that? Especially with the meds and his history here. His lunch was a sandwich on white bread. It was usually processed lunch meat or tuna or egg salad. His supper was fast food, so typically pizza or meat and potatoes or pasta. He would drink 3 liters of water a day. So he's got something going for him. He's drinking good water, but I think that's because the diuretic is dehydrating him. What do I see in his eyes? Notice that we have a slight milky film. Very, very slight. It's in the early stages at the top of his eye. That is in the cornea. That's not in the iris. That suggests that his liver is not handling carbs properly and could be throwing him towards blood sugar or towards cholesterol and triglyceride issues. He has this dark ring, this ring right here, that this is telling us that his stomach doesn't like its job very well, likely not secreting enough acids. And we see that the collarette is atonic, which means he's likely going to have sluggish bowels. And if we check his bowel transit time, it's probably going to be longer than 18 to 24 hours. And he's probably fermenting things in his intestinal tract, which is going to lead to gassiness. So I asked him, do you pass gas? Yes. Does it have an odor? Yes. What does it smell like? Is it putrid or is it slightly sweet? Slightly sweet. So we know it's carbs that he's not handling. We also see these wrinkles in his eyes out here. These again tell us that he functions in his sympathetic nervous system. So we had to do some changing. Now, I'd already had these conversations with him before, so I wasn't being too gentle. He knows better. He just needs a reminder. So we suggested getting protein and vegetables for breakfast. A couple of eggs with some stir-fried veggies would be ideal. Suggested that he could snack on an apple with some really clean nut butter if he needs a snack. His lunch, we wanted lots of veggies. I suggested going with leafy greens and real meat. So cook some extra meat the night before, have that with lunch the next day. Supper, I wanted more protein and veggies. So I tease my clients and I tell them their new mantra when they're meditating, they don't all meditate, is protein and veggies, protein and veggies. And I literally do that in front of them. It makes them laugh, but it ingrains it in them. Suggested the veggies could be stir-fried or roasted. They could be a stew. He could grill his meat, right? But portion control was going to be important here. And I wanted him to chew his food well. So what did we do for supplements? I mean, that was a lot of diet work. I would not do that with someone usually on a first appointment, but this was not his first appointment. He needed a push. We got him to use some L-arginine, which, as you know, is an amino acid that helps to produce the nitric oxide, which can help to vasodilate. We got him on some berberine IR to help him with his blood sugars. We got him to start walking twice a day for 30 minutes a day. Easy to do because he's a security guard. And 1 week, every other week, he's actually out doing the perimeter tour. And the rest of the time, he is in a computer room. But we actually got him to get some stretchy bands so that he could do stretchy band exercises in the computer room. In his follow-up appointment, we added protein digestive aid and garden essence, so some things to help him digest his foods better. And by that appointment, prior to that appointment, even with medications, his blood pressure was still high normal, so pushing 130 over 80. With these changes, we got his blood pressure down to 118 over 74 as an average. We also, in a matter of about a month to 6 weeks, got his blood sugars down to in the 5.9 to 6.3 range, and his hemoglobin A1C down to 5.9. Amazing. Over the course of the following about a year and a half or so, his doctor has removed the giardians and the glumetza because the cholesterol and triglycerides are coming down, and so is the blood pressure. The doctor's already starting to reduce those medications, right? And so when we see all of these markings, we are able then to understand more about him. Now, I want you just to take a really close look at his right eye, right here. Squint if you need to. Can you see right there? And a tiny, tiny bit here. There's a tiny bit of something that's a little bit of a different color. Like it's not boldly a different color, but it's slightly different color. That suggests that he may have MTHFR. I can't diagnose that, and our labs here won't even test for it anymore. But when you know what MTHFR is and does, that will add to the challenges he has with keeping his cholesterol in check. So we know what we need to do with his supplements and his lifestyle, making good progress. Lost a few pounds in the process, which he was happy with. Are we good with that? Did that all make sense? How we correlated his symptoms to his eyes, to the recommendations? Yes, fantastic. Let's do a biliary eye type. The beauty of doing iridology this way and creating rapport is, again, clients want to come back. This is a very dear to my heart client, actually. She has been with me for over 4 decades. She was one of my first clients, and she disappears for a while and comes back. She just was in a couple of weeks ago, and she brought me this lovely tea mug as a thank you gift. And it's like, oh my goodness, just touches my heart. So she started coming back about four years ago now. And much the same concern. She was in her mid-60s. She was gaining weight. She wanted to lose the weight. She'd been to the doctor. She had been diagnosed by the doctors having high blood pressure, high cholesterol, high triglycerides, elevated hemoglobin A1C. So she was on that type 2 diabetes tread. She was so going that direction, and she didn't want to go that way. And the doctor just wanted to give her drugs. She has been with me a long time. She also has a lot of knowledge. She knows a lot about diet. She knows a lot about herbs and about nutrition and about emotion and its impact on health and things like that. So she just needed me to, again, help her get started and get on the right pathway. She begged her doctor, she said, okay, I'll take your medications after 3 months, but I'm going to do 3 months of really hardcore work. I'm going to go back and see my herbalist and my nutrition coach, and I'm going to do 3 months of hard work and see if I can change these numbers. Well, that's exactly what she did. She came back. We buckled her down to a diet that was primarily protein and veggies, lots of leafy greens, not too much fruit, getting rid of the refined carbs. She could have some whole grains if she needed to, lots of good water, some good herbal teas, just clean things up, got her being active, walking for 30 minutes twice a day. And it was so good because at the end of 3 months, she went in to see her doctor, got her labs done. The doctor went, well, whatever you're doing, it's clearly working because all of your numbers are in the normal range. And she lost 20 pounds. So this was so good. So how did we know what to do? We've got her symptoms. That alone tells me a lot. She's got that white haze at the top of her eye. Body's not handling carbs well. We don't know which direction it's going, right? We've got the pigment in her eye. Is she MTHFR? Knowing her family history, probably. We've got contraction furrows. Does she burn through her B vitamins too quickly? Likely. And if they're not methylated, they're not doing her a whole lot of good, right? We look at the colorations of the browns and the golds. We know the liver needs support. We know we need to pay a little bit of attention to her kidneys here. And so as we worked together again, we cleaned up her diet, like I said, we got her being active. Her supplements that we decided to use, omega-3. I felt like omega-3 was an important one for helping to break down any potential for clotting that she might have. Berberine IR for the blood sugars. We worked on her gut biome, both with food choices and with supplements with some, and I'm not a fan of probiotics, but we got her doing some fermented vegetables. Got her making some fermented vegetables and introducing those so that we could re-inoculate her biome naturally. Protein digestive aid because we'd increased her protein intake, digestive enzymes to help her handle carbs and fats, and protein at breakfast, so critical to give that thyroid that first morning love by balancing the blood sugars right out of bed, right? She was doing so well. And about a year later, her family had a major crisis in the family, and it just derailed her completely. She fell off track and regained the weight. And about 6 months later, she had a heart attack. Now, heart attacks are often stress induced. And when you understand where the heart attack is in the heart, it tells you what kind of stress created this. Fortunately, her husband recognized what was happening, and they live about 2 minutes from a hospital. He threw her in the car, got her to the hospital. She lived, obviously, because she couldn't give me a nice tea mug if she hadn't. And because now she's on the medical treadmill, she's doing 9 cardiac medications now, 9. She doesn't want to be on them, but now she's got her head back into a space where she's thinking, there must be other things I can do. And she knows there are other things she can do. So now we're working with, okay, we want to work with digestion, but she's not comfortable taking enzymes anymore. What can we do? Well, we can have her use more ginger in her meals. We can have her use more savory herbs in her meals because those will stimulate digestion as well, right? If she's, and we're just going to work gently like that with food choices and with adding culinary herbs until we get her back to where she's got her confidence back, at which point we may be able then to do other things. Like with her salads that we're trying to get her to eat more leafy greens, can you use flaxseed oil and vinegar as your salad dressing, right? Can we use the healthy oils to make your oil and vinegar dressing rather than giving you supplemental omega-3s, right? How can we work this through? So she's making some great progress again, and I'm looking forward to working with her for several more months before she fades off to just do homework. And hopefully we'll get her to where we can start introducing little bits of supplement to support what she's doing. Now, to that end, I think it's really important that as holistic practitioners, we be very aware of drugs. So, an idea of having a drug reference book on your desk where you can look up the medications. I like this one because it does list contraindications for what herbs and vitamins and fruit juices and things should not be consumed with a particular medication. So that could be very helpful to you as well. All right. Do you know anybody who you think might have biliary eyes? If you do, give me eyes in the comments box. Do you know anyone who you think might have biliary eyes? So they're not pure brown. Yeah, Kara's husband. Ah, there you go. Well, maybe you've learned something here that will help your husband today. That would be so good. This again, we've actually talked about this client already a little bit earlier on when we looked at the hematogenic eyes. In the old type of iridology, I would have said she needs a parasite cleanse, and we would have put her through a parasite cleanse, but you know what? These would not have changed. And so we would have said she was headed for a nervous breakdown. Now she does tend to be a little anxious, but I would not say nervous breakdown, but it does tell us how she uses her B vitamins. It does tell us how she responds to stress, right? So we've talked a lot about her case already. And so rather than necessarily going through all of it, I think we will leave it at that. We haven't touched any on sclera today. Just isn't time to do it all. So with that, just want to take a couple of minutes to introduce you to the Dynamic Iridology Assessment System program. It is the only live, online, fully mentored course for nutritionists, herbalists, nurses, doctors, naturopaths, EMTs, anyone who's got that college level anatomy and physiology under their belt. It's to help you learn iridology at a clinical level, not just to learn the nuts and bolts, but to learn how to integrate it with what you already do so that it's useful to you. Learning another skill that is a standalone skill that you can't integrate is just a waste of time and money, right? You need to be able to use this and use it well in order for it to be valuable. The purpose here is to help you assess your clients more quickly on a more meaningful and deeper level, create that rapport, get their programs created quickly so that you stop donating hours to create programs, because you don't get paid for those, so that you can stop creating programs that are going to overwhelm your clients. The more time you spend creating a program, the more you're putting into it, the more overwhelmed the client's going to be, the more likely they are not going to come back because they couldn't do what you wanted them to do. So this is about helping you to learn, teaching you iridology in a way that helps your clients to be highly successful, that helps them want to come back, that leads to the long-term retention, things like what I've talked about here, like 4 decades. I've had so many clients in that 20 to 30 year longevity range where they're coming back over time again and again. So important. That's what the course is about. The next start date is April 11th. The program meets for 20 weeks, one time each week for 20 class sessions from about 12 noon till about 2:30 Mountain Daylight Time. Registration is done via a one-to-one meeting with me on Zoom. And this is really important. I need to chat with you to make sure that we're a good fit for each other, that you've got anatomy and physiology, that this is where you need to be at this point in time. Sometimes it is, sometimes it's not. And I really don't want to have students in the class where it's not the right fit, because then they drop out. That affects the energy of the whole class. And my goal here is to create community, right? And so really important to me that this is a good fit in every way, shape, and form. So I've posted a link in the chat box. If you've got your college level A&P under your belt, and if you would like to have a chat with me to get all the nitty gritty details, I'm going to give you a few of the details in just a moment, but the nitty gritty details like payment plans and tuition and things like that, then use that link to schedule a meeting with me and let's talk. It's not a high pressure sales call. It really is to give you a tour of the student site, to talk about any questions you have, for me to make sure that this feels right for both of us before we actually invite you to enroll. I want to know where you're at, what your goals are, where you want to take this. How can I support you the best to help you reach your goals and become who you want to be with this? And you know, I'm going to share with you like my 40 years of experience in teaching and coaching people. The course itself is, again, 20 hours, 2.25 to 2.5 hours long. Each class is recorded for playback on demand because I know you've got a life. And there's going to be a time when you can't make it to class for whatever reason. The classes are recorded, so you can listen after the fact. I've had some students that lived in time zones where the class just was not going to work. They've done the entire course with the recordings because we have so many other ways of supporting you. This is one of them. We have live group mentoring twice each month via webinar. So we've got 2 times scheduled each month, and they don't change their times. This is for all my students and all my graduates. You've got a question about iridology. If you've got a business question, because we don't have time to talk about business in the course, if you've got a case you're working on and you would like some support with that, you bring that into office hours. And I'm there. We've got students who are certified graduates. We've got other students who are in process, and we all weigh in on things. Everybody who shows up at office hours weighs in. This is an optional thing, but it's included for you. So if you can't make it, that's fine. These are recorded. So if you can't make it and you want to listen in later, you can, right? We have a private group for students and alumni on MeWe, which is a platform like Facebook, except that they don't mine our data and we can speak freely. They don't censor us. And so again, once you're a student, you don't get kicked out of this group. The comments from Karen Choate, she was certified years before she posted those comments for me, right? And so you don't get kicked out. I take only 10 students per cohort maximum, because I want you to feel comfortable asking questions in class and asking for the support you need. If the group is too large, a lot of people are too timid. They don't want to make it look like they aren't getting it. And my feeling is the only stupid question is the one you didn't ask. Because if you've got a question and it doesn't get answered, I can't build on what you know. I include a 225-page digital textbook, which you are welcome to go in and invited to go and get copied at your copy shop. It's a book I wrote, so I can give you permission to do that. And 45 pages of digital study notes. We call those the cheat sheets. Now, these are both things that I have created, and they've been approved by IPA. All of my teaching materials have to be approved by the Education Standards Board in IPA, and mine have met that with flying colors. And I include the IPA certification mentoring. You will see a lot of teachers don't include that. You pay for your course, you do your course, and if you want to certify, you pay an extra fee to be mentored. I include the mentoring as a part of your tuition, right? Because I think it's important. It's a way of me encouraging you to, take this to the goal line. Let's finish this process and get you certified, right? So important. Sophia Perez-Villar came to me. She was already certified as an iridologist. This is what she posted on the International Iridology Practitioners Association website. The commitment Judith has for teaching is extraordinary, and the amount of support you get from the iridology course is fabulous. The material is very clear and thorough. The pace of the course is dynamic, but with enough time to integrate all the parts. As this was my second iridology course, I was not sure if the course would just be an add-on, but it has exceeded my expectations. I've learned lots from the course material and classes, expanded previous knowledge, and gained more confidence. I can see now how this course has helped me to get better answers from my clients and to design an effective protocol in very little time. Highly recommended for beginners and advanced. Love that. Kimberly Zadalis, laws of background, brand new to iridology. She has a master's degree in radiology, and she works in a radiology clinic part-time, and then she has her own holistic health clinic that she runs as well. If you are wondering which iridology course to take, you can stop looking. You found it. Judith Cobb is an excellent instructor with many years of experience. She is a caring and compassionate person who is dedicated to the field of iridology and her students. I personally practice both Eastern and Western philosophy medicine and was very impressed with the layout of her program. She makes it easy for her students to balance work, life, and study. Really like that one. Sharon Bimrose also came to me already trained. I've had a lot of people who've come to me with no training at all. Brilliant. I love starting them out at ground zero and laying that foundation and building on it with them. Sharon is a naturopath in Australia, and as such, she had to study iridology. She says, Judith's course, Confident Nutritionist Dynamic Iridology, we changed the name a year or two ago, surpassed my previous training in structure, content, delivery, documentation, and support. Judith taught in a manner that I could understand visually and auditory. Dynamic iridology was well delivered, inspiring and motivating, giving me the much needed structure to the knowledge I had already learned over the years. Dynamic iridology also provided me with the most up-to-date iridology information, along with the added bonus of Judith's extensive experience of holistic health. In absolute appreciation, Judith, I thank you for making me a better iridologist. So with that, again, my friends, just if I want you to be typing in any last minute questions you might have, because we're just about done here. The next course is starting on April 11th. If you have a glimmering of interest in this, if you think, I've got that A and P, I want to learn more about this course, use that link that I posted in the chat box and schedule a time. If you don't have A and P under your belt already, and you're thinking, I want this course, reach out to me. I will give you a link to an A and P course that meets the requirements that you can do on your own schedule. It's a self-paced course. And once you've passed that, then we can have a conversation about bringing you into the iridology program. Because I would love to see you in the iridology program. I'd love to meet you in a call to see if this program is a good fit for you. I'm not seeing any questions come in. However, I would love to chat with you. So I'm hoping you've each grabbed that URL, tinyurl.com/dynamic-iridology. And again, love to chat with you about the program, about your goals, about what you want to accomplish, and let's see if this is the right thing for you. Thank you so much for being with me for the past hour and a half. I really appreciate that. I hope you have a brilliant day and a lovely Easter, and I will talk to you soon. Bye for now.